Living with Alzheimer's disease or other dementias is difficult for any patient and their caregivers as well. A study released earlier this year found the obstacles are even greater for people of color. WCPO 9 News reporter Lucy May spoke with a local woman who navigated those challenges with her late husband and interviewed experts about improving care for everyone.
Right at about age 50, my husband started demonstrating some problems with memory.
Marilyn Anderson's husband Herndon was diagnosed with mixed dementia, with multiple types of dementia occurring in his brain at the same time.
We had about 10 years of care that I provided at home, primarily while I was working. And then as his dementia got worse and it was more difficult to manage at home, he was placed in a nursing home for about 6 years.
Anderson says she was grateful that many of her husband's caregivers at the facility were African Americans.
Particularly when a person might have days or times when, their behavior is the result of their feeling agitated or more confused. It was really helpful, and I was very grateful that there were staff members there that were not overwhelmed by that or were not fearful of him. My husband was, a relatively tall, strong-looking African-American male, and that could have resulted in over-medication or someone saying, hey, we don't think we can continue to care for your husband here.
We really did find some alarming numbers.
Amy Boehm is Health Systems Director for the Alzheimer's Association in Ohio.
2/3 of Black Americans believe that it's harder for them to get excellent care for Alzheimer's disease and dementia.
Numerous studies have told us that only about 1 in 4 patients and families struggling with dementia really get a good quality of care. So we already see that it's a relatively somewhat scarce resource already.
Anderson says she learned lessons with her late husband that she wants to share with all families.
For persons who have dementing illness and they cannot advocate or speak for themselves, it's critical that family members are heard, because otherwise you are at risk of mistreatment, over-medication, just not giving the best care because you may not read the signals, the expressions of a person accurately.
Lucy May, WCPO 9 News.
The Greater Cincinnati chapter of the Alzheimer's Association has a forum coming up in June called Empowering African Americans in Navigating Dementia Care. You can find information on how to register in Lucy's online story at WCPO.com.